Hello, everyone. Thank you so much to Elise Gellerman and to the Neuroendocrine Tumor Research Foundation and the Patient and Caregiver Committee for this wonderful opportunity to present to you on finding a supportive community, how NET support groups can help. My name is Maigenete Mengesha, and I am one of the senior support counselors at Wellness House in Hinsdale, Illinois. And through my role, I have had the wonderful privilege of facilitating our neuroendocrine tumor support group. So over the past 6 years, I have got to witness the experience of neuroendocrine tumor patients and their loved ones. And I am basing this presentation on the experiences of how important it is to find a supportive community. So for my first slide, why should NET patients and caregivers seek support groups? As we all know, the disease is rare. And so I say that to say that in comparison to many of the other cancers, neuroendocrine tumor is rare, therefore it's important to come together and unite and have a shared common experience. Additionally, some of the other cancer types have a more typical protocol versus what it is for the NET clinical and treatment course. So there's so much variability from patient to patient. It's even more important to come together and process both emotionally and from a factual perspective what those experiences are like. Similarly, the incidence and prevalence rates of patients with neuroendocrine tumors are steadily rising. So there's a larger group of people, there's a larger mass to come together and really talk through what that experience is like, to share strategies and pitfalls. And then the exciting news is, as we know, is that patients with NET are living longer. Therefore, there's more to talk about. There's more of an experience of what it's like to have NET for 10 years and 20 years and on. And so there's really a desire and a need and a curiosity to share that common experience. The benefits of group support versus support from family and friends. One of the biggest, I would say, myths about groups is, you only join a support group if you don't have a supportive group of friends and family. And I want to really debunk that myth, because while family and friends serve a really important purpose in the process, there's a unique experience and a unique sense of community that comes about when joining a support group. Especially with the support group of folks that have a rare cancer. So there's as I mentioned, a sense of community, there's an unconditional acceptance, and importantly, there's information about the NET experience and its treatments that maybe the common person is not familiar with. And so what I hear time and time again is that sometimes talking about the experience of NET with family and friends can lead to feelings of isolation and rejection, a lack of knowledge, and just, frequently feeling like an outsider. And so this just really highlights the benefits of coming together with folks that are going through your similar experience. Perhaps they're in your shoes, maybe a few steps ahead of you. So this is a really important thing to consider. The greatest benefit of participating in a neuroendocrine tumor support group is an increased sense of empowerment and agency. And I hear this time and time again, even from one visit, one support group visit, is people leave feeling more empowered, a higher sense of control of their medical care, and more agency to seek medical care that is appropriate for their disease. So, many times people come to our support groups, maybe seeing a general oncologist. And while that might be good for some, one of the main things that we really encourage is to get with a NET specialist. And so it's great to have that be information that you hear from peers that are in your same shoes. So there's just an increased confidence and a sense of control in relation to yourself and your disease and living with NETs, and then interactions with others. In particular, being able to navigate the NET medical profession. So some of the additional benefits of participating in an NET support group are gaining a sense of hope. So it can be amazingly powerful when you see others in the group who are further along in their emotional management of NETs. It can be such a source of inspiration and hope, and really increase one's will to live. Honestly, it's that impactful. And why not? This next point is that it's affordable. So we know that a cancer diagnosis can be traumatic. A cancer diagnosis of a rare disease such as NETs can be even further traumatic. So there might likely be a need for some emotional care. And why not get with a group of people? Sometimes, many times, the groups are offered free or likely cheaper than individual therapy sessions. So if we know that it can be a traumatic experience, getting with a group of people to help support you emotionally is a sure way to combat that. So there's so many types of neuroendocrine tumor support groups that are available, whether it be online, in person. There's also, kind of two camps. There's the peer-led groups and there's the facilitator-led groups. What I want to communicate is that it's really up to you to decide what fits. We strongly encourage you to attend any group in person or online at least 3 times to really get a sense of what it will be like. And then you use your own feelings as a barometer. How do you feel after you've participated in a group? Do you feel more encouraged? Do you feel a greater sense of agency? If you do, then continue participating in that. If you leave a group feeling maybe more anxious or a little bit more worried, perhaps discouraged, then that might be something to check in with yourself about. Maybe it's not the group for you. Now, what we do know is that while there are NET support groups, there are a growing number of them, they're still a little bit more difficult to find. So if you do live in a community that you can access one, such as in the Chicago area where we are, it is kind of a rare opportunity. And so we do encourage you to seek those out. And that brings me to my next slide of, so how do you find a neuroendocrine tumor support group? The main way is to ask your neuroendocrine tumor medical provider. Again, we encourage those impacted by NET to get with a specialist, an NET specialist, versus a general oncologist, and they can help you perhaps suggest or guide you to your search for a support group. For example, at Wellness House, we have a close relationship with some of the neuroendocrine tumor specialists that are in our area. And so in our group, we have Dr. Koikin come, sometimes on a quarterly basis, so once or twice a year or so, to come speak to our group. And so there's that relationship. So he's able to refer patients to our group, and patients that in his patients are also able to speak about him and his work at our support group. Another option is to check out your local cancer community support centers. There's other facilities such as Wellness House that have a whole host of cancer-specific support groups. And so one of those may be an NET support group. And then also on a more national level, looking at the Neuroendocrine Tumor Research Foundation national database for local support group centers. And I have the link included in this slide. And lastly, I just want to end with highlighting Wellness House and how to get in contact with us. I am, again, Maigenete Mengesha. I'm very happy to, if there's any follow-up questions to this brief presentation, I also want to direct you to our main website. We have a host of opportunities. We operate from a holistic model. So in addition to our NET support group that we offer, we have a host of other programs that may be available. Many of our group members are such strong advocates that they have devised the Chicagoland Neuroendocrine Tumor Network. And so they have a Facebook, they have a website, and so I wanted to plug them and their work as well. Their mission is to provide timely information, resources, and events about neuroendocrine tumors. So please, I strongly encourage you to check them out as well. Thank you so much for this opportunity.